My name is Russ Jaffe. I'm a physician and biochemist, a certified clinical nutritionist, and I maintain a fellow status in the American Society for Clinical Pathology, the American College of Nutrition, the American College of Allergy, Asthma, and Immunology, the Federation of Clinical Immunology Societies, the American Medical Laboratory Immunologist, and I'm an overseas fellow of the Royal Society of Medicine. I'm a fellow of the Health Studies Collegium, a research foundation, and director and founder of ELISA Biotechnologies in Perk. The reason that I maintain my relationship with these very different aspects and subspecialties within medicine is to integrate on your behalf the information, the knowledge, the wisdom that I glean from each of these perspectives and bring them together in what we call the Alkaline Way. Now, our focus here is on the immune system, and we'll start with healthy immune tolerance, a review of what the immune system is like when we're healthy, and when we are healthy, our immune systems are tolerant. This means that healthy innate immune cells, the first responder cells, are able to do whatever work is needed. There are no allergies. The immune system is tolerant. The immune system then engulfs, breaks down, and uses the building blocks from anything foreign. The healthy innate immune system neutralizes infections and allergens, breaks them down. The healthy innate immune system cells repair us from daily damage. And the healthy innate immune system cells delete abnormal, pluripotential, or what we call cancer cells. So our innate immune system is tremendously important if we want to avoid chronic infection, if we want to repair from daily wear and tear, if we want to delete the cancer cells that everybody makes every day and that healthy people are able to delete. So the takeaway is that the healthy immune tolerant system provides us with 50 billion white blood cells that recycle pathogens without any infection. Many people have the misunderstanding that if you're exposed to a pathogen or a bacteria or to something infectious, that you automatically get sick. Actually, it's just the opposite. Out of every 100 people that get exposed to most infections, 1 or 2 at most will get sick. And an epidemic is when 10 out of 100 get sick. So most people neutralize, recycle, break down without any adverse effects foreign materials that invade the body. Now, the immune system is responsible for enhancing activity when needed. That is, we acquire an immune response to stop the burden. And when we're a hospitable host, when our immune system is weak and needs support, then, but only then, are we hospitable to Lyme parasites. And allergens do provoke symptoms. Repair is too often deferred because the immune system has a priority. And the priority is to do defense work first. And when that's done and cleaned up, then we can get back to doing wear and tear repair. Then we can get back to identifying and eliminating cancer cells. But if we are hospitable and we're exposed to partially digested food remnants, if we're exposed to an assault of foreign invasion, then our immune system springs to defensive work, and in that defense work, it may be so preoccupied that it's not able to repair nor eliminate cancer. And by repair, I mean the chronic degenerative diseases, those associated with diabetes and cardiovascular problems, autoimmune problems, the conventional degenerative diseases, the ones that slowly slip us downhill. All of these have in common a lack of repair, a repair deficit. All of these have in common a burden on our immune system, either because it doesn't get all of what it needs and it's weak because it lacks the essentials, or because of toxins that weaken it, or just because of overwork from too much foreign invasion. So LRA by ELISA tests are a breakthrough. They are functional tests to identify the causes of immune overload. And lymphocyte response assays, the LRA by ELISA ACT test, uses exactly the memory white cells that the body programs and then uses within those programs to respond and amplify any immune responses to this extra defense workload. Now let's look at the immune system briefly. Our perspective is physiology, how things work. And looking at physiology first, the alkaline way in Lyme, we find a loss of tolerance. When tolerance is lost, then chronic infection and autoimmune risk both increase. So a hospitable host has an overload of foreign reactive antigens. Mostly this is from digestion, an overload of remnants of digestion. And since infectious and non-infectious items are equally foreign to the IDRS, the Immune Defense and Repair System, it's perfectly reasonable that when people have maldigestion, say because they've had histories of antibiotics or they've been exposed to certain stresses and toxins, that their impaired digestion will then lead to a burden on the mucosal and then the systemic immune system, and when unresolved, when unmediated, when unmitigated, autoimmune diseases are the rule. We've had the pleasure of contributing a series of articles on this subject to Townsend Letter for Doctors and Patients, and you're welcome to look at that reference at the bottom of this slide, and at the classic Gell and Coombs reference back in 1963, when they articulated the 4 subtypes of immune reactions that have stood scientifically as evidence to this day. Type 1 being the immediate acute allergy. These are IgE mediated. This is what allergists conventionally take care of, either with skin tests and shots or with sublingual drops. But then there are the delayed types 2, 3, and 4. Types 2 is humoral or antibody, IgA, IgM, IgG, but only the bad antibodies, not the good antibodies. Only the symptom-provoking, not the neutralizing and protective antibodies. And then type 3, the immune complexes, IgM, anti-IgG antigen, and type 4, the T cell, direct responsive immune activation, independent of antibodies. The T cells don't depend upon IgM, IgA, IgG antibodies, although there may be some IgD on their surface. So the overloaded immune system in Lyme is the way it is. We at Perk Integrative Health and ELISA ACT Biotechnologies, we rethink health. We rethink health from the physiologic perspective, from the participant, from the person's perspective. And when we look at this chronic illness called Lyme, we recognize inflammation, which is really repair deficits. We recognize the pain, which is really secondary to swelling because of the repair deficits. And these are often local and focal. These can often be small areas of swelling that impinge on certain nerve bundles and sap both our vitality and our comfort. So Lyme and chronic hospitality equal degenerative and autoimmune illnesses. And so Lyme and the chronic hospitality to Lyme is simply one aspect of people who are hospitable hosts to these degenerative, to these chronic, to these autoimmune conditions. So the immune system in Lyme has the challenge of restoring tolerance, restoring resilience. We want to look for a moment at what we're dealing with. First of all, in regard to Lyme, there are many different organisms, many different infectious agents associated with them, but they're all weak parasites. Weak parasites. They're not aggressive. They're weak parasites that only express themselves when there are essential nutrient deficits and or distress hormone imbalances and or digestive and detoxification health impairments and or environmental toxins. So if you have enough of the essential nutrients not to have deficits, if you balance out your attitudes, activity, and nutrition so that your hormones, neurochemicals, and immune surveillance systems are all resilient, If you have healthy digestion and detoxification competence, if your environment is nurturing and not costly, then these weak parasites are not able to get hold of you. But when you are hospitable and they take hold, they can seem pretty aggressive. Now, what about when do Lyme disease cases occur? The next few slides are mostly from the Center for Disease Control, and I'll very briefly review a conventional understanding of Lyme and the common vector-borne illnesses. It is the most common vector-borne illness in the United States. It is now thought to have a global distribution. And as you can see, the cases occur most often during June and July, during the summer, at a reported rate of 70 to 80,000 per month. And in months like January and December, maybe 5,000 cases are reported. Now, in regard to Lyme disease, only in hospitable, susceptible hosts, but in hospitable hosts who are susceptible, then if an infected tick has within it the eggs of the organism, if that infected tick cycles between a reservoir like a mouse or a deer, you can have the conditions where the Borrelia burgdorferi or other organisms like Ehrlichia and Babesia are transferred in a set of host cyclic reactions that end up with the infected tick inadvertently biting a hospitable host. And if you just looked at this slide alone, you might think that the arrow pointing at the person from the infected tick to the human is a necessity, that it always happens. The fact is that out of 100 people who are bitten by infected ticks, out of 100 people bitten by infected ticks, maybe 1 out of 200 will go on to the chronic form, and many more will have an acute episode that we'll talk about, and talk about how we suggest managing it physiologically rather than pharmacologically. Now, Lyme disease in regard to hospitable host vector cycles, it's a little bit complex, but look at things as they go in their cycles. And let's start on the left. And let's start with, actually, we'll start in the middle on the bottom with number 1. The tick takes a blood meal. So the tick bites a mouse, let's say, and draws blood from it to nourish itself. Its saliva contains, in this case, the trophozoite that then cycles through the mouse to become the merozoite, that becomes the gamete that's infectious. And now we go over to the left and we see the tick takes a blood meal from the now incubated mouse. And in the gut, fertilization happens. The ookinate enters the salivary gland, and sporogeny occurs, and sporozoites then are released into the saliva, so that when that tick takes a blood meal from a person, as you see at the middle top, that person can receive the sporozoites, and then the life cycle goes on and can be transmitted even from human to human in blood transfusion. Again, from looking at this on its surface, you would think that everyone who was exposed got infected. That's not the case. The host has to be hospitable, and even then, only a very small fraction of people actually become ill. Now, what about the presentation of Lyme disease? Lyme disease presents after certain weeks of incubation, and I want to emphasize that infection happens only when the phagocytic cells, the dendritic cells, fail. When the polymorphonuclear leukocytes, when the monocytes and macrophages, when they're doing their job and they're energetic, they take in the Lyme organism, the Borrelia, the Ehrlichia, the Babesia, they put it in a lysosome recycling center, they break it down to its building blocks, and then they build themselves up from those building blocks. Now, as you see on the left of this slide, the bullseye rash is considered to be pathognomonic. It indicates an immune spreading with the antigen antibody complexes at the perimeter, where you see the circle, and the very center being the place where the immune system is fighting, but not effectively fighting, the infection. If you look at the right, you see that erythema migrans, the rash, occurs in a little more than 2/3 of cases, but that means that 1/3 of cases, people never see the rash. Arthritis or joint pain and swelling occurs in about 1/3 of cases, but in 2/3 it's absent. Facial palsy, very prominent when it does occur, only occurs in 8%. Radiculopathy or pain down certain nerve roots at 4%. Meningitis or encephalitis in 1%, and heart block in 1%. But if you were that 1%, if you were that 1 in 100, that would be very meaningful to you. So occasionally meningitis and encephalitis, occasionally heart block or radiculopathy are actually the way in which Lyme presents. And while the bullseye rash is pathognomonic, it doesn't always happen, and you look at the full constellation of the individual to decide what to do. Now, the early disseminated stage occurs in days to weeks after the tick bite, only when the innate immune system fails. That's the point we want to emphasize, is that only if the innate immune system fails do you go on to this disseminated stage. There are additional lesions in other parts of the body. Facial or Bell's palsy happens when muscle tone is lost in one or more critical fifth cranial nerves or branches of the cranial nerve. And as you see in the picture on the lower right, there's a facial palsy on one side of this person's face and not on the other. That asymmetric Bell's palsy may be an indicator of Lyme's. Severe headaches and neck stiffness or meningismus or due to meningitis can be ways in which Lyme presents. Pain and swelling in large joints, the arthralgias and arthritides. Shooting pains that may interfere with sleep, and we know how important restorative sleep is, so anything that interferes with that we're concerned about. And then heart palpitations and dizziness, secondary arrhythmias, probably from low magnesium and metabolic acidosis, as well as from antioxidant deficiency and an excess of oxidative activities, all of which the high pH and the oxidative activities predispose to Lyme and Lyme type of parasites, whereas having a healthy low redox and a healthy pH of 6.5 to 7.5 on the first morning urine is associated with resistance and resilience and not hospitality to Lyme. Now, in regard to Lyme disease and its late symptoms and comorbidities, host hospitality can occur long after the tick bite. And we suggest this is because of repair deficits secondary to the burdened immune system. This is usually because people have not identified the foods and chemicals that are burdening their immune system, nor the Alkaline Way diet of choice, nor the targeted supplementation, activity, and attitude practices that promote good health. So on and off bouts of arthritis with severe joint pain and swelling, especially in the large joints like the knees, about 60% or almost 2/3 of patients have this autoimmune mystery associated with their Lyme disease. About 1 in 20, about 5% of untreated patients develop chronic neurologic complications or complaints months to years after the infection, and we suggest that these neuropathies are mostly B-complex deficits, and that indeed the person may have been marginal with regard to essential nutrients when they were initially exposed and hospitable to the Lyme organisms. So in a sense, Lyme disease is part of autoimmune self-attack. It is today's great imitator. The underlying Borrelia, Ehrlichia, Babesia infections have comorbidities in common with a variety of autoimmune conditions. These are secondary to unresolved immune defense and repair system burden, unresolved stress on the immune system, and the conditions most commonly associated, the autoimmune conditions, are lupus, Hashimoto's thyroiditis, multiple sclerosis, Sjogren's disease, rheumatoid arthritis, and diabetes. So very common conditions are autoimmune, and multiple autoimmune conditions are the rule rather than the exception. And this includes in Lyme disease, which either is or has aspects of autoimmunity, especially in its chronic phases. And T cells from Lyme patients react against Borrelia burgdorferi, specific antigens, but also against various host or self antigens. So we see Lyme disease then as a repair deficit inflammation, an inflammatory process where enough of the good stuff is lacking and too much of the bad stuff is present. So cross-reactive, harmful antibodies are common. Helpful antibodies are rare. When the immune defense and repair system burden is not identified, then such antigenic mimicry may generate autoimmune inflammatory repair deficit reactions that could be responsible for the neurological symptoms associated with chronic Lyme. And we want to stimulate repair and restore immune tolerance. And here we've paraphrased Letov and colleagues' rather seminal article about the neuropathy and cognitive impairment following vaccination with OSBA protein of Borrelia burgdorferi. Here's another slide that comes from Nature Reviews. Lyme disease, the NK positive T cell role when dendritics are pooped. And here we also want to start at the top center. We see the spirochete with its flagellum, its wiggly tail, its membrane lipoprotein, and its non-lipidated proteins. And these can then interact. On the left, they interact with dendritic cells, and they release interleukins like IL-6 and IL-10 and cyclooxygenase, and TNF, IL-1 beta, IL-12, IL-8. These are either arthritogenic or anti-arthritogenic depending on their impact on the joint. If you look at the middle, you see the Th1 cell. These are T helper cells. They can be directly bactericidal, or they can mature into ARP1 specific B cells or T cell dependent cells that either become antibody factories or specified subgroups of T cells. So there's a good deal of complexity of how these spirochetes interact with the immune system and how the immune system interacts back. The takeaway is healthy people with enough of the essential antioxidants, buffering minerals, with enough of the hormone balance and neurochemical balance to be resilient. Those people bring the foreign spirochetes or parasites into dendritic cells where they're processed, or into macrophages and similar polymorphonuclear cells where they're broken down and recycled. Now we get into some of the details. In regard to Lyme disease, deficient host mechanisms are a necessity. Healthy people do not get sick. And here's a 2004 paper from Journal of Clinical Investigation by Lisa Glickstein and colleagues. And what we see is that the organisms, the spirochetes, can get to a macrophage. That macrophage can process the antigen and present it, as you see in the lower left, to a CD8 or a CD4 cell, depending on who's available. The CD4 cell can help and activate B cells to turn them into antibody factories known as plasma cells. Or the organism itself can interact directly with a B cell and then turn that B cell into an antibody factory to produce immunoglobulins. And if the person is healthier, those immunoglobulins, those antibodies that are produced, are neutralizing and protective. But if the individual is not healthy, if their pH is too high or too low, if their redox potential is too high, if they do not have enough antioxidants, if they do not have enough buffering minerals, then instead of producing neutralizing beneficial antibodies, they produce unhelpful antibodies. Lymphocyte response assays are comprehensive and functional tests. In regard to Lyme disease, delayed or occult reactions mean that they're harder to identify. It means that the reactions types 2, 3, and 4 that we'll talk about, the antibody immune complex and cell-mediated reactions, these occur days to weeks after the exposure. And even the most careful of histories is usually not able to detect such reactions. Allergy tests are different by design, and we're going to look at the accuracy, the functionality, the comprehensiveness, the proven outcome studies, the treatment guides, all of which together lead up to successful clinical outcomes, and why LRA by ELISA ACT tests are your smarter choice, because LRA by ELISA ACT tests work better. LRA by ELISA ACT tests are exceptionally accurate with less than 3% variance day to day. They are functional, that is, they're ex vivo, they're true cell cultures, and they uniquely allow the immune system to react in the laboratory just as it does in the body. They're comprehensive tests with proven outcomes in community-based randomized controlled trials. We now have a treatment plan based on over 50,000 cases to help personalize and individualize the recommendation about what we should eat and drink, about what targeted supplements, about what activities and attitudes would most likely help us. And all of these are brought together in LRA by ELISA ACT tests and successful clinical outcomes to be managed. Now, Lyme-delayed allergies, the cells do mediate. And from our physiology first perspective, we acknowledge that the reactions are delayed hours to weeks after the exposure. We acknowledge that there are 3 types of delayed allergic pathways. And we acknowledge that IgG antibodies are static, that testing for antibody without testing for function is frankly confusing, because most of the antibodies are neutralizing, beneficial, and protective. Some of the antibodies are reactive. We think you should know which. And that's where functional tests, LRA, lymphocyte response assays, ELISA, LMRA, where functional tests of lymphocytes responding under controlled laboratory conditions have much advantage. So Lyme-delayed allergies are the rule. The reason that people are hospitable to Lyme is very often because of these delayed allergies. And so we want to suggest testing the LRA tests, lymphocyte response assay tests, because now you get all of the delayed mechanisms concurrently and functionally measured. Now, static delayed allergy tests are confusing. IgG, ELISA IgG, EIA IgG, IgG4. They quantify the presence or absence of an antibody without telling you the function, and that's just confusing. And then there are cell size or automated cytotoxic tests. They measure any particle at 10 microns, and they're confusing, because 10 microns might be the size of platelet aggregates or red cell rouleau stacks or debris from immune reactions. Lymphocyte response assay, functional LRA by ELISA ACT, with the validated, that has been validated in outcome studies. This test is truly functional. Only the harmful reactive lymphocytes react, and we're thus able to distinguish the bad from the good antibodies. It's an ex vivo LRA by ELISA ACT assay. It's ex vivo, meaning just as it happens in the body, but under laboratory controlled conditions. And indeed, as these cells speak, we listen. And here's a lab technician who views the cell just as they occur in the body. And that visual observation, that visual contact and observation is really needed for accurate and meaningful interpretation of results. Here you see the difference in LRA by ELISA ACT between positive and negative wells. On the left, non-reactive. On the right, you see the cells light up, a kind of halo effect. And that's what the technicians see and are able to distinguish reactive from non-reactive patterns. LRA by ELISA test is the best for accuracy, the best of all cell function tests, based on an average test result from 50,000 cells per well, with less than 0.1% false positives, less than 1% false negatives, and less than 3% day-to-day variance. We're very pleased to be able to report that between technicians and between specimens from the same individual. Functional LRA by ELISA tests measure only reactive antibodies, B cells and T cells. So much more comprehensive than IgG tests, much more meaningful, predictive than cell sizing tests that measure a specific size particle. And LRA by ELISA provides true causes of immune overload and subsequent symptoms, personalized action plan, and an action plan designed to get results more safely, more effectively, and more completely, more sustainably. So LRA by ELISA tests are simple, based on 1 ounce, a small blood sample. That blood sample can be used for up to 480 different lymphocyte response cell culture assays, ex vivo tests every one. So the largest number of foods, additives, and preservatives, environmental chemicals, toxic minerals, medications, molds, danders, hair, and feathers, and herbs can be tested. You set what we should test, we do the testing, we return the report, and if you request, we can have a treatment guide as to what to do with the results. Here's a case. A 43-year-old woman had 4 pregnancies and 2 live children, 5 feet 4 inches, 145 pounds, a college graduate from Mills College. And she'd had routine childhood infections without sequelae, including German measles, mumps, and chickenpox, received routine childhood vaccinations, but otherwise unremarkable history, a non-smoking professional sculptor, occasionally exposed to chemicals used in patina coatings on bronze, for bronze sculptures. She had brief use of oral contraceptives between age 22 and 28, no recreational drug history, and currently resides in Fairfax County, Virginia, and Mercer County, New Jersey, both of which have a high incidence of infected ticks. Her presenting complaints were joint pain and a bullseye rash on her right rump, where she had no moles or tattoos. The laboratory results, including the complete blood count, electrolytes, liver function tests, kidney function tests, calcium thyroid function, adrenal stress hormone function, and digestive transit time, were all unremarkable. Borrelia burgdorferi antigen was positive. Ehrlichia and Babesia antigens and IgM antibodies were negative. The treatment was no antibiotics, but the LRA by ELISA plan to boost immune reserves and resilience and restore tolerance. In this case, the LRA by ELISA program and PERK nutrients were used to reduce the immune burden and substitute for reactive items, using high-potency nutritional supplements and living well the Alkaline Way, a way of incorporating how we eat and drink, think, and do into our daily living. So in this case, the implementation was based on the Health Appraisal Questionnaire, the HAQ, to determine personalized activity, attitude, and supplement needs, and included PERK Potent C-Guard and PERK Pain Guard Forte to address repair deficit inflammation, PERK Endura Pack Guard and PERK Digesti-Guard Forte, PERK Regularity Guard to address digestive issues and reduce host hospitality, PERK Life Guard, in this case double strength was used, or now the mini capsules, to provide a comprehensive multi, and PERK MitoGuard Plus 100, the micellized CoQ10, and tocopherol vitamins E to enhance cell energy efficiency. So for specific boosting of essential nutrients that contribute to immune resilience, PERK Potent C-Guard and Pain Guard Forte, PERK Endura Pack Guard and PERK Digesti-Guard Forte, PERK Regularity Guard, and PERK Life Guard DS or mini capsules, PERK MitoGuard Plus 100 were all used. In this case, the Alkaline Way involved and included dichromatic green light, salt and soda baths, abdominal breathing, and Traeger movement education as habits of daily living. 6 months follow-up was current infection stopped. IgG Borrelia antibody was 4+ positive, showing memory to prior immune response. IgM and IgA were negative. 22 years of observation following without relapse. The Joy of Food, the Alkaline Way guide became important in knowing how to implement the alkaline way of eating. Another case is a 9-year-old young man who presented with arthralgias. He was 4+ positive and protected from all organisms east of the Mississippi that were linked to Lyme disease. The PERK Integrative Health WellGuard program with a 14-year observational follow-up, no sequelae, no relapses over those 14 years. I can tell you that that young fellow at the age of 23, just a few months ago, was bitten by what appeared to be an infected tick. It was properly and correctly removed, but a slight erythematous or red area around the bite suggested the need for a PERK potency cleanse, as well as enhancement of what would now be called PERK Repair Guard rather than PERK Pain Guard. And since the young fellow in question is my son, I know the case well, and his mother is the other case in point, so I know that case well. And I'm glad to tell you that we do apply to ourselves, to our loved ones, and to others the experiences we share with you, and we are looking forward to your having the same beneficial results following the alkaline way, using physiology first, recognizing that what we eat and drink, think, and do is critical, and that we have choices about those that can translate into lower or higher risk. It's up to us. So our immune system can be reset. Our immune system can be renewed. Our immune system can be repaired. And our immune system can be tolerance restored. That is, it can be tolerant again. LRA by ELISA tests and treatment guides, comprehensive delayed allergy tests that deliver results. We are pleased to be 25 years young and then some, and looking forward to the next 25 years of helping people feel and function better. The Alkaline Way to Health includes our handbook that makes the plan easy to follow, The Joy of Food, the Alkaline Way Guide, and that's available both digitally and in print forms. It is a guide to healthy living through the acid-alkaline balancing of food, substituting for reactive foods, and behavior recommendations so that what we think and do complements what we eat and drink. So in summary, in Lyme's, we want to restore resilience in the immune system because the weak parasites only exist in the absence of the good stuff or too much of the bad stuff. So with these weak parasites, we want to use the PERK Integrative Health WellGuard nutrients. We want to use the PERK Integrative Health Hormone Balance Plan. We want to use the PERK Integrative Health Digestive and Detox Health approach, and we want to use the PERK Integrative Health WellGuard program. So we can take the vision of thinking and doing, eating and drinking in a more healthy way. We can take that into practice, specifically with regard either to managing Lyme diseases or to preventing us from being hospitable to Lyme. So only a hospitable host gets infected, and only a host that lacks essential nutrients or has dramatic increase in the stress hormones or the toxins that become sick and persistently so. So Lyme illness is one of the scourges of our time, one of the problems of our time, and responds very well to this physiologic approach, physiology first management, using the alkaline way.